Hello and welcome back to one of our school panels. My name is Enrique Hasso. I am the Director of TMDSAS and Community Outreach and Engagement here at the Texas Health Education Service in Austin, Texas. Joining me today are two wonderful guests. Joining us all the way from the Rio Grande Valley, we have Dr. Javier Lafontaine and Mr. Gilbert Morin. Good morning to you both.
Morning.
Morning. Thank you so much for joining us. And we're really excited that you took the time to join us, mostly to share insights not just into the School of Podiatry, but also into the profession as a whole. I know that there's a rich history of need for podiatrists in the state of Texas, and I'm sure you will touch on that. But we're really excited to be partners with the very first school of podiatric medicine here in Texas. And so, without further ado, I will hand the stage over to you both.
Okay. Thank you, Enrique. All right. Well, good morning. Good morning to you all, and Enrique, thank you again for giving us this opportunity. Your kind introduction. I'm Javier Lafontaine. I'm the dean of the School of Podiatric Medicine, and like Enrique said, we're here today to not only talk about the school, but also introduce you to the great profession of what podiatric medicine and surgery is. Next. So the School of Podiatric Medicine at UTRGV, or University of Texas Rio Grande Valley, started with the first cohort back in 2022, in August 2022. We are the first and only podiatry school in the state of Texas, and we are one of 11 of it. But we are the only state-funded podiatry school in the United States. So all the other schools are essentially private schools or somewhat affiliated to another university, but not necessarily state-funded. We received the candidacy status in 2022 as well. We are in the Harlingen campus of UTRGV. So if you Google or go to UTRGV main campus is in Edinburgh and Brownsville. We are in the middle in Harlingen, which is the smallest campus. We have a very low cost tuition compared to all other schools. And then financial assistance, financial aid, and all that is very similar to any other medical dental career. We are approved by the state to have up to 40 students. 90% of those needs to be from Texas. Only 4 seats can be from out of state. The first cohort of students, we had 27. The second cohort, the class of 2027, are 36 students. And we are currently recruiting for our third year, the third cohort. Next. So what is podiatric medicine? I mean, essentially, to make it simple, we are a regional specialty of the foot and the ankle. It's almost like going into a subspecialty in medicine from the get-go. That's basically what it is. So we take care of any ailment on the foot and the ankle from the medical perspective and the surgical perspective. So we can take care of skin problems all the way to fractures of your ankle or the foot. All the scope in between, we can take care of that. And why is that so important is because, some of you might be thinking, well, foot and the ankle, how much disease you have there? Well, we have a lot because most of the chronic diseases, believe it or not, have some manifestation on the foot and the ankle, like diabetes, obesity, aging, arthritis, vascular disease, just to mention few. And I would go into more details about that later. But basically, believe it or not, we're just a reflection of many other diseases of the body. So we are an important part of the medical community nationally and in the world, and we take pride on keeping America or keeping Texas walking. Next. But the need, like Enrique mentioned earlier, the needs of podiatrists is immense, especially in the state of Texas. This is a table from the Department of Health Health Services here in Texas. And if you go now and try to open your own practice and you go to a bank and ask for a loan, you have to show that you're going to go to a place where you can be successful. They probably want to see anywhere between one podiatrist per 15, 20,000 people population ratio. So if you look at this table, you can see metropolitan area, just the bigger cities in the state of Texas, you're at 1/25,000. So you can essentially open your own business and you probably will be successful just looking at the numbers. But it's dramatically increased when you go into a non-metropolitan area or even to a border or non-border towns. I mean, that ratio just significantly increased. So not only if you want to be on the big city, but if you want to expand and be a newcomer in other areas, your opportunity is just immense. So the state indeed is a very good place to practice podiatry. Next. But why to become a podiatrist? You know, this is a picture of a patient of mine that I dearly saw for many years. You can see he has a prosthesis made by his son. So that's a wooden leg, and his son was able to carve the malleoli of the ankle and the toes and everything. But my call for podiatry was this. You know, I wanted to take care of patients to prevent this. But you can do many other things. But why to become a podiatrist? Well, it's a shortage of physicians in general, and that also applicable to podiatry. You know, baby boomers and the generation to follow, we are getting into 50s, 60s, 70s, and 80s. So with aging, you get more foot problems because diabetes, malalignments, bunions, arthritis, you know, many things get to those population. But not only that, but we take care also sport medicine injuries, trauma injuries, kids. We take care of those. So it's a wide spectrum that we take care of disease. But something that I enjoy of my profession was that for the 9 out of 10 situation, I was able to cure people. You know, it wasn't a life or death. It was a lot of the time was a amputation or not, but we didn't deal too much with life or death situation, and I felt that curing things was rewarding enough. Next. So you are essentially a medical specialist. That's what a DPM is, Doctor in Podiatric Medicine. You can practice general practitioner in your office, do a lot of things that I talked to you about, but you can also dig into sub-surgical specialties. And you have the freedom of having your own business if you want to, or, you know, own multiple practices, or you can be on a solo practice and many other areas that you can work. And I'll talk to you about that in a minute. Next. So, you know, being a podiatrist, like I said earlier, you know, you do curable things, you know, you do with curable pathology, but you are able to take people out of pain, return them back to activity. And it's a financially rewarding profession just because of the need of the specialization. Next. So this is where podiatrists typically work. Most of podiatrists will go to a private practice or multi-specialty clinics. You know, my first job when I came out was in Austin Diagnostic Clinic. It was a practice of 150 physicians from all specialties, and we were 4 of us practicing in the clinic. So it's a common way of you developing a practice. But I switched to academics. Many of us go into academics. We teach on podiatry school, medical schools, and many other colleges and hospitals as well. We have a big presence in the government with an Indian health reservation in the VA hospitals. There are a little bit over 150 VA hospitals in the nation. They all pretty much have podiatrists. And podiatrists are also hired by hospitals to provide inpatient care because diabetes continue to grow, trauma continue to grow. So podiatrists now are hiring by hospital to work mostly on an inpatient basis, um, to take care of the foot and the ankle. But we also go into administration. You can go into health plans, hospitals. You can become CMO, chief medical officers, or directors of wound care programs, and go into research as well. And last but not least, if you like to be on the community doing public health, that's also an option. Or you can go to pharmaceutical. I have a lot of colleagues that has been working with pharmaceuticals, doing medical education about products and about diseases. So that's another new opportunity that podiatry has been doing. Next. Podiatry education is very similar to medical education, osteopathic education, dental education. Your first 2 years are basically classroom teaching, and you take courses very similar to the other colleagues I just mentioned, right? Anatomy, histology, biochemistry, physiology, and so on. Our curriculum is module-based system, or it's a system module, a system-based module where you kind of apply the same topics I just have on these slides, but more as a clinically oriented from the first year. So basically, you're not repeating your bachelor in biology again in medical school, right? Or your bachelor in chemistry. You have kind of more of a clinical application for your first 2 years. But the caveat on this is that you also start podiatric medicine, surgery, and biomechanics. You have a longitudinal module. So you have a medical dental module, right? Like I described, plus you have that podiatric medicine, surgery, and biomechanics. The medical module is tweaked a little bit to kind of be more concise toward podiatry, but it's essentially pretty much 90% the same as any other medical school. So it's a very heavy first 2 years of your curriculum. Then your third and fourth year, you go into your clerkships where you do clinical rotations in medicine, family medicine, general surgery, orthopedics, behavioral health, and then you do also podiatric rotation. So it's usually your third year is a split between 6 months in non-podiatric rotation and then 6 months of podiatric rotations. Then your last year, when you do your externships, that's when you go out there, visit residency programs, and other externship outside the state, outside the city of Harlingen, and then you get exposed to podiatry for those 12-month rotation. Next. You do need residency training in podiatry. Pretty much every state requires you to have a residency program. Residency programs in podiatry are 3 years. Okay, you don't do like medicine. You have 5 years orthopedics, and internal medicine is 3. The same thing with dentistry. Orthodontics is 2. General practice is 1. Podiatry, you go 3 years. Your first year, you do mostly non-podiatric rotation. So you learn about internal medicine, radiology, anesthesiology, general surgery, orthopedics, vascular surgery. And then you do podiatry. Also, very few. But the last 2 years, you mostly do podiatry, medicine, and surgery. Why you need to do that is because patients are a whole, and a full system. So you're going to be operating in the ankle or in the foot. You need to know about the health of your patient. You need to be able to recognize the risk before you take them to surgery. You need to recognize the risk when you treat them in your office, and respond to what might happen in the office when you're seeing these patients. So it's very important. Your training is comprehensive like any other profession. Next. And this is kind of a slide showing you the differences, right? When you do the podiatric training to the medical school or medicine, you do your 4 years, you do your 3-year residency in podiatry, but in medicine is different length depending what you want to do. You have the option to do fellowships, so you can subspecialize. So I want to do my 3-year residency, but I want to do sport medicine. So I might do a fellowship in sport medicine to just create that niche within the foot and the ankle where I can specialize on. And then that's optional. Fellowships are optional. And then you will get certified by your profession. You get board certified in surgery. You get board certified in podiatric medicine or whatever. And then certification process are usually 2 parts, just very similar to our colleagues in other medical professions. Next. Currently, these are the podiatry school in the United States. You can see where they are scattered. We are the only one in Texas. The other ones are usually major cities. So usually your cost of attendance is much higher when you go to those other schools versus here that is obviously, lower cost of living, and the tuition is about half of compared to the other schools. Next. There are 7 podiatric residency programs in Texas. So as you finish here, you can also have the option to stay in Texas. All these residencies just not only accept Texas students, they're open to the whole nation. So, but they're currently functioning. They're being present anywhere between, 12 to 30 years. So we've been training podiatry residents here for the past 30 years, essentially. Basically, these residency programs are mostly in Houston. There's one in Temple, Texas, one in Greenville, Texas, and one in Fort Worth. And then there's one in San Antonio, and the rest are in Houston. We are actually applying get approval for a residency program in the Valley to start 2025. So stay tuned. We might have an 8th program here. Next. And I mentioned to you fellowships, and these are all the areas of fellowship where you can do. These are again optional, but you don't have to do a fellowship. But it'll give you an idea where you can go to different niches and create those for your needs. If you want to do that for the get-go, most people develop their own niche after their experiences, right? I mean, you get a job, let's say, like for me, for example, I ended up with my first job in Austin, Texas, which was very heavily not elite athletes, but a lot of outdoor people. So I saw a lot of joggers, a lot of golfers, a lot of hikers. Then I changed my job and I ended up in San Antonio, and all of a sudden it switched and I start seeing a lot of diabetic patients. So, and essentially that's where I developed my passion, and I developed my own niche in diabetic foot care. And I never did a fellowship on it. But following that Austin job, my 18 years, I just did diabetic stuff. So I developed my own niche. I did not need a fellowship, but you can do that from the beginning. You can develop a fellowship and then go from it. Next. So these are some of the demographics of our students right now. You can see it's very diverse. You see we have people from all ethnicity and all part of Texas, basically. The first class, like I mentioned earlier, the class of 2026 is 27. The second class is 36. Is half and half, male, female, basically. We have one student out of state in each group. Next. So that mission requirements, that probably we can leave that more to the Q&A, but I just briefly tell you what is in this slide. Gilbert will be probably the best person to really dig into all this information, but it's requirement very similar to, MD, DO, dental schools. We take the MCAT. We don't accept the DAT, but we take the MCAT You need at least 90 hours of college credit. Most of our applicants have bachelor degrees. Hopefully, we can maintain a GPA of 3.2 in sciences. The MCAT average is probably around 498, 496 right now. The cutoff is 492, somewhere around there. But I just mentioned those requirements, but we really put a lot of weight on what you've done. You don't have to done everything, but we want to see people that are committed to the career, to medicine, to take care of patients, because this is a vocation. Just becoming a doctor and dealing with sick people every day, for 30 years, you have to have some type of calling, and we want to see that in your application. And again, I just told you this, but if you're below in any of those, still apply, because there's a lot of things we take in consideration when we pick applicants. So feel free to apply and reach out to us for any further question, but feel confident that our approach is take a look at as a holistic approach to every student. Next. And I'm going to go briefly to some of the picture of stuff we do. You can see here, this is a patient that had a diabetic with a significant infection. He went into an amputation. Obviously, we don't want to do those, but sometimes we can save the limb. So this patient unfortunately end up like that. Next. And then we do, ingrown toenail. This is probably some of you might have them. And if not, you will meet somebody that have them. So because it's very common, but this is an office procedure. We take care of that. We often remove the part of the toenail and do that. Next. This is a localized infection on a patient that stepped on a thorn. And we saw him in the ER, take him to the operating room, and he ended up with a large soft tissue loss and essentially a chronic wound because of the infection. Next. This is a colleague of mine picture, but this is an ankle fracture repair with an internal fixation. We do quite a bit of those when you go into that part of your practice. Next. This is a different patient. This is somebody, older patient with an ankle arthritis. He was fused after failing the bracing, shoes, and this other thing that we also do, right? That we make sure we order those and fix those before we have to end up with this type of procedure. Next. This is another way of the way we treat arthritis now with ankle joints, arthroplasties, and implants. Next. This is a heel bone fracture that required fixing for somebody that fell, about 6 feet or so and fractured the heel bone. Next. And bunions, those are kind of bread and butter. You can see on the left the first metatarsal of the big toe bone that you can see, and now how it's get aligned and put 2 screws fixation to make it nice and straight. You can also see those correction. Next. And last but not least, kids. A lot of kids with flat feet, knock knees or genovalgus, what we call. They end up with a lot of foot problems. We see a lot of those. Mom and dad brings them for their concerns, and we can, order shoes, insert, fix them surgically. Sometimes they just take minor things to take care of. So we do some of those. Next. And this is our contact information. There is the general email for us. There is my email. I'll be more than happy to answer any question. Give me about 24 hours. I'll get back with you for sure. And our website has a lot of more information, a lot of details. And this is our barcode, the QR code. So you can take a picture or go to our website and go from there. And that's all I have. I'm open for any questions.
Wonderful. Thank you so much for walking us through those steps. I know um, with podiatry, I think one of the slides that stood out to me the most is just the incredible need that the state of Texas has for podiatrists among different city sizes. And I think that's one of the things that may be a little concerning for somebody who may be considering a career path in health professions is a lack of awareness about the podiatric uh, medical profession and pathway there. So hopefully, if some of the images that Dr. LaFontaine shared with us appeal to you, or perhaps didn't make you run the other way. Luckily, now we have Mr. Gilbert Morin to share with us a few insights into how to apply to podiatry school.
Thank you, Enrique. Um, Similar to the most medical schools in Texas, the application is done through TMDSAS. You'll submit your application and through their portal. As Dr. LaFontaine was mentioning, the requirements are very similar to going into the MD program. There's really not too much distinction on it. We look at everything. We want to make sure that students that apply to our school are well-rounded students. So that's our holistic approach. And regarding the GPA science requirements, we find a strong correlation of, students that are at a 3.2 in their sciences GPA and their success into medical school within the first 2 years. Now, with the MCAT requirement, just because it may be on the lower end compared to traditional medical school, doesn't mean that the rigor of the program is not as intense, because you have to keep in mind that since our curriculum is tailored off an MD curriculum, it also incorporates the podiatry courses in there that serves as longitudinal courses. So the program, the DPM program, is just or more intense as going into a medical school. But regarding also with some of the things that we have to offer, we have some of the best faculty in their field. We do also offer, students get to use our donated specimens in their first year of medical school. We have research programs that are also available for students as well. So we just have a wide variety of amenities and some of the best state-of-the-art equipment as well. So our application for this cycle for entry year 2024 has been extended to June 28th of 2024. Our application also opened up for the next cycle too as well on May 1st. So our application, I think the first round is probably going to be closing on March 28th of 2025. So if you're interested in applying, or if you have a question for us, please feel free to email us at dpmadmissions@utrgb.edu. If you feel that you're not ready yet to apply, or you may feel that some of your requirements may be a little bit lower, I would recommend that you submit your application in to us, and then that way we can review it, because again, we use that holistic approach. So we just want to make sure that students are well-rounded. We can also provide shadowing opportunities as well. So if you send us an email and you want to shadow a DPM, we have a running list of DPMs throughout the state of Texas that we can put you in contact with. Okay. So we do look at about a minimum of 25 hours of shadowing. And the reason that shadowing is we're starting to take a little bit more focus on this area is that we want you to make sure that this is a profession that you want to apply to. And then that way you can get a better understanding of the profession and see it on a firsthand basis. And I would recommend also to shadow a couple of DPMs, okay, because one may offer better insight than another. And then that way you can just, make a better informed decision when it comes to choosing your career path. So podiatric medicine is an option for healthcare, and it's a very important part of healthcare.
Absolutely. I think especially as we're seeing more multidisciplinary approach to healthcare, podiatry is a very important presence. As Dr. LaFontaine was mentioning, we're starting to see podiatrists in hospitals, in having them much more accessible to patients. I did want to take a couple of minutes here to talk about the application process on the TMDSAS end for those of you that have been watching and are interested in applying. As part of our Inside Health Education newsroom, we do have an article that outlines the steps for you to go ahead and apply to podiatry school. As Mr. Morin mentioned, the application is still open for entry year 2024. And so if you have already submitted an entry year 2024 application and have not yet applied or have not yet been accepted at another member institution, you can go ahead and send us a message through the internal messaging system to add the UTRGV School of Podiatric Medicine. If you've not yet submitted an entry year 2024 application, you can actually go ahead and start an application on the TMDSAS portal. I'll show you shortly. What you'll do is you'll start an entry year 2025 application and then send in an IM to request access to begin your 2024 application. And just so you know, this would only be including the school, the UTRGV School of Podiatric Medicine. As a reminder, the last MCAT test date for applicants to entry year 2024 will be May 24th. That will make sure that you have your MCAT scores in time for the deadline of June 28th. So that's for anybody that's interested in starting podiatry school this year. So if you are interested in podiatric medical pathway and you are ready to go, this is a great opportunity for you to go ahead and start with that career path this year. If you are currently applying for entry year 2025 application, you can go ahead and start your application at tmdsas.com and go ahead and start your entry year 2025 and select the UTRGV School of Podiatric Medicine on your application. So just to give you a quick walkthrough here of the TMDSAS application, here is my application on the TMDSAS website. You'll have to bear with me because I am one of the worst applicants and don't have all of the sections completed yet. However, I do want to point out here on the select schools end, when we go to that page, you can actually select the schools to which your application will be sent. So you can actually come down here, select UTRGV School of Podiatric Medicine, and save and continue. And so once you go ahead and submit your application, it'll end up going to the UTRGV School of Podiatric Medicine. So we've covered the application end. Mr. Morin has given you some insights on a holistic review at UTRGV School of Podiatric Medicine and giving you some great advice in seeing how the school partners with potential podiatrists and sharing that amazing list of podiatrists that you can go out and shadow anywhere in Texas. And of course, Dr. LaFontaine shared with us the importance of the podiatric medical pathway. Before, as we're kind of starting to wind down the session, I did want to ask a couple of questions of you both, if you wouldn't mind me putting you on the spot.
Yep, it's fine.
I know some of the questions that applicants ask of our medical schools have to do with the importance of specific elements like research in their application. You've mentioned the importance of shadowing a podiatrist to ensure that somebody is actually aware of which pathway they're going into. And so I have to ask the question, is there any specific section that is particularly looked at in the podiatric application that perhaps you'd like applicants to take advantage of to really show their commitment to the pathway?
Want to take this?
I can take it. Yeah, well, I can take it from my point of view. I think to us, one of the main important part on the applicant is would be shadowing, like Mr. Morin mentioned. That's an important path because I think that way they get introduced and at least know what the podiatrist does. Once you go over that, your application probably is going to be strengthened for any research that you have done. I think that's important. In our first cohort, we're going to have a student finishing with a PhD. Did a DPN PhD program, and that was his interest. So he did that, and he did have some of his research background before he applied, but it wasn't like that's all he's done in his career, right? But he has shown that interest, so it was an easy transition once he came to the podiatry school. I think it's important to show in your application that you have some commitment to service, right? To something that you are willing to give back. And that might be going to places where you help people, but you can also give back, participating, volunteering in a hospital, volunteering in a clinic, give back to your church, to your community, because like I said earlier, it's a vocation thing, right? I mean, you have to demonstrate that in your application, that this is what you really want to do. Is the bottom line is help people, take care of people.
Two things that I forgot to mention, Enrique, and to everyone watching, is that we don't have a secondary application fee. Okay, so we waived that. So you just submit your application through TMDSAS, and the other is that we're also DACA friendly. Okay, as being already difficult for DACA students into pursuing a graduate professional career, we're breaking down barriers and providing opportunities for students otherwise where they may not have an opportunity to apply to a medical school due to their status. Now we've broken down that barrier for them and provided an opportunity for them to apply to a medical school.
Great, thank you for sharing. And just if you have any questions for either Dr. LaFontaine or Mr. Morin, again, here is the contact information for the UTRGV School of Podiatric Medicine. The QR code will send you to the website for UTRGV SOPM. We've also shared a link here in the chat for you to explore a little bit more about the school. As we close out the session, I did want to offer you both an opportunity to essentially talk to our future podiatrists and share your insights, maybe some words of encouragement as they're looking toward this career path.
I mean, I think I first got exposed to podiatry because I was a patient, and I think I was probably about 9 years old, and I got custom-made inserts because I'm flat-footed, so I was doing track and field, and essentially I was growing, so every 2 years I need to get a new custom-made inserts. And so by the time I graduated from high school, I kind of knew that's what I wanted to do. So for me, it was an easy decision. But the rewards I received from being a profession confirmed that I did the right thing. And podiatry, I don't have anything bad to say as a podiatrist. I mean, you might think I'm biased or not. I could tell you other stuff, but I think the profession really opened, provide all the opportunities I needed, which was taking care of patients. It gave me an itch of doing what I wanted to do. I started thinking I wanted to be a sport podiatrist, and I became something else, Ben. And once I became I got the opportunity to be on a university system, then I knew that the foot and the ankle had to do so much with medicine, and that I was just, the bottom line is you're taking care of patients, no matter what part of the body you're taking care. Some people go to medical school and just decide to take care of the eye. Some people, do the nose. You're doing the foot and the ankle from the beginning. That's really what the difference is, because everything goes back to taking care of the patient as a whole. So to me, it has been a career that really provided me what I needed to do. And I can just welcome you to a profession that is going to open doors for you in the future.
Thank you so much for sharing that.
Yep, absolutely.
Yes, sir.
Yeah. For me personally, when I first learned about podiatry, I was working as a director of financial aid for the School of Medicine, and I started hearing podiatry, and I had never heard about it. So I was, did my research, and I started finding it. And I'm like, wait, my father was actually a double leg amputee. So when it kind of shocked me upon learning about that the school was coming down and what the profession is. In my mind, I always thought it was a MD that had done the procedures on my father, and my father lost his legs due to his diabetes, and so ultimately leading to to his his demise in healthcare. So it just kind of showed me how important this field is. Had we taken it his issues more seriously, and to see what ultimately diabetes can cause to people. So in the Rio Grande Valley, as Dr. LaFontaine was mentioning, has one of the highest diabetic rates in the U.S. So it was very I guess special to me to see that the school was coming down here to the Rio Grande Valley to help address some of these needs and other health care ailments. But it was just interesting just to see that there's a specific profession that's dedicated to working on the lower leg extremities.
Thank you also for sharing, Gilbert. I think some takeaways for you watching here is this is a very viable pathway for you. If you're interested in pursuing the health careers as a profession, we highly recommend that you take a look and really seriously take up our colleagues here on their offer to connect you with podiatrists in your area, to explore the profession and really understand what it is that podiatry does. A podiatrist does, and really explore the opportunity that's available there for you. This is very similar to a medical path, but can be very different in some other ways, and perhaps those ways really align with your personal journey and your goals. And so I really encourage you to take the time to consider podiatry as a pathway, and just know that there are resources available for you out there, and you can count Dr. LaFontaine, Mr. Morin among those resources to help you be successful. So thank you both again so much for your time today and for sharing your insights and wisdom with our viewers here.
Thank you so much, Enrique.
Thank you. And on behalf of the UTRGV School of Podiatric Medicine, the Texas Health Education Service, and TMDSAS, we'd like to wish all of you all the best of luck on your journey. And don't forget that there are folks here available to help you, and we're ready to make sure that you are successful. So until next time, thank you so much for joining us. And we look forward to seeing you all later this month for a student panel with some podiatry students. If you have any questions for them, students will always tell you exactly the truth. And so we're really excited for that session.
Yeah.
Yes, sir. All right. Thank you so much again. Have a wonderful day.
Bye-bye.